Let's explore a nightmare. You get into a car accident and are rushed to the nearest hospital. Since you're unconscious, you have no say in the medical network, doctor, or procedures needed to save your life. Thankfully, you wake up, only to discover that your insurance doesn't cover the medical care that saved you. Suddenly, you owe more than you make in 5 years. Sure, you're alive, but you're drowning in the kind of debt that makes bankruptcy look awfully appealing. If you know nothing about the American healthcare system, or if you're relatively wealthy, this kind of situation may seem absurd. And yet, it's a reality that millions face every year in one of the most broken healthcare systems in one of the richest countries in the world. Welcome to the American healthcare nightmare. Hope you brought a lawyer.
Debt from medical care has skyrocketed in the United States. More than half of all the bills in collection right now are medical bills.
U.S. healthcare spending reached an astonishing $4.1 trillion in 2020, or about $12,530 per person. But how much of that is debt? It turns out the answer is not easy to quantify. In recent years, politicians have championed the idea that America's medical debt constitutes an $81 billion crisis. But thanks to the restrictions underlying that statistic, the problem is likely much, much worse. Consider Stanford economist Neil Mahoney, who pegs the nation's medical debt at a conservative $140 billion, that he can prove anyways. Or the Kaiser Family Foundation, which found that American healthcare debt topped $195 billion as of 2019. For a sense of scale, that's more valuable than the entire economy of Greece. While our population's medical debt is likely closer to the KFF's figures, the truth is it's hard to pinpoint our exact debt load because it's not recorded like traditional debts. One Peterson KFF analysis estimated that just 9% of adults, or around 23 million people, owe traditional medical debts over $250. Of that group, 3 million owe more than $10,000. Meanwhile, the Consumer Financial Protection Bureau reports that nearly 2/3 of all debts and collections stem from medical bills. And yet, it's likely that the kinds of debts that appear on consumer credit reports represent a mere fraction of the total Americans actually owe for healthcare. One KFF-NPR joint estimate suggests that 100 million adults, or 41% of the over 18 population, currently owe healthcare debts. Around 50 million adults, or 1 in 5, directly to their healthcare provider, over 40 million, or 1 in 6, on their credit cards, some 25 million, or around 1 in 10, to friends or family members. Out of these, the study found that around half of adults who owe medical debts owe less than $2,500. The other half owe more, sometimes considerably more, and sadly, 1 in 5 don't ever expect to pay it off. But all this debt is fine, right? Wrong. So very, very wrong. Families that carry medical debt are substantially more likely to have to slash essential expenditures like food, clothing, and even shelter just to pay their bills. This isn't just true of lower income families either. 51% of those who report cutting expenses due to medical bills earn over $90,000 per year. And nearly half of all families with medical debt report draining their life savings just to claw their way out. In turn, these burdens prevent Americans from investing in their children's futures, borrowing for college, buying a home, or even saving for retirement. Long term, these consequences bleed into society, as fewer in the younger generations go for homeownership or even have enough to rent a decent apartment. Less money saved for retirement translates to less spending power as individuals age into their 60s. Perhaps most diabolically, having medical debt is one of the best indicators that a person will avoid or even be turned away from future medical care. Around 2/3 of US adults report putting off essential care due to sheer costs. Because of these delays, many adults develop more severe and expensive problems because they couldn't afford treatment when their concerns were in their infancy. While these problems don't exclude high-income households, it's no surprise that those who can least afford such expenses are hardest hit. People of color, individuals with disabilities, and adults who can't afford insurance are more likely to have medical debts. Shockingly, or not, debt levels in counties with higher rates of disease can be 3 to 4 times what they are in healthier counties. Another indicator that you're more likely to carry medical debt? Living in a Republican-led state that denied citizens access to expanded Medicaid under the Affordable Care Act. We'll come back to that one. Data from the Consumer Financial Protection Bureau finds that medical debt is now the #1 source of debt collections, surpassing credit card, utility, and auto loan collections combined. This has occurred even as strong economic growth has heralded nationwide decline in all sources of debt, including healthcare. But you can't just not pay your debts. Insurance companies, hospitals, and debt collection agencies hound those who can't pony up. In some cases, hospital networks have been known to sue their patients, even when they couldn't begin to afford a payment, let alone a lifetime of debt. That leaves many families with just one recourse: bankruptcy. While exact numbers vary over time, medical bills are commonly reported as the #1 cause of, or contributing factor to, U.S. bankruptcies. For instance, a 2009 study by Harvard and Elizabeth Warren found that nearly 2/3 of all bankruptcies were caused by medical issues, either the debts themselves or being out of work during recovery. A later study found that 66.5% of all bankruptcies were tied to medical issues, accounting for about 530,000 bankruptcy filings each year. Some reports are more conservative, though also narrower in scope. For instance, a 2011 report showed that out-of-pocket medical expenses influenced 26% of bankruptcies in low-income households. A 2014 survey by Northeastern University determined that 25% of bankruptcy filers considered medical bills to be their chief concern. Whatever the exact statistics, it's easy to say that in the last decade, millions have been forced into bankruptcy, driven from their homes, or forced to rely on friends and family just to pay essential healthcare bills. We said we'd come back to the ACA, and here we are. Following the passage of the Affordable Care Act, bankruptcy filings dropped substantially, about 50% between 2010 and 2016. We can't solely credit higher numbers of insured individuals, though. An improving economy, as well as a 2005 law making it harder and more expensive to file, also contributed. Still, many legal experts believe that spiking health insurance rates played a hefty part. This theory is supported by CDC data that finds between 2011 and 2016, the number of people who reported difficulty paying medical bills dropped from 21% to just 16%. That said, the ACA didn't solve everything, particularly in predominantly red states that gutted healthcare protections. Remember that Stanford economist, Neil Mahoney? According to his research, while the number of unpaid medical bills declined greatly post-ACA, these declines have been smallest in Republican-led southern states that rejected the ACA's enhanced Medicaid packages. The data shows that annual rates of new medical debts fall by half in states that expanded Medicaid, while those that didn't saw a decline of just 10%. Meanwhile, the gap in amounts owed by low versus high-income residents widened in states that rejected Medicaid expansions, while it narrowed in states that accepted more healthcare dollars. The exact reasons for this are too complex to go into here. Suffice it to say, the popularity of high-deductible plans among insurers, excessive out-of-pocket maximums, and healthcare costs that have risen at double the pace of wages all contribute to the problem. In other words, even though more Americans have health insurance than ever, for many, the only answer to medical debt is a medical bankruptcy. And if that's not a nightmare, we don't know what is.